Is this thing on?
I am Queens.
Hi everyone, my name is Alyssa, and you are listening to the All Things Pelvic podcast, where you get to follow my life as a pelvic floor physical therapist. That may sound a little boring, but real quick, let me break it down. I bring up topics that most people find difficult to talk about, but maybe it's time we get comfortable with discussing the uncomfortable. I always strive for real talk, good vibes, and mostly all things pelvic. Join me and my guests as we discuss healthcare, culture, and real life topics. Are you ready? Because it's time to take a page out of my playbook. Hi everyone, it is a gloomy Saturday in New York, but also I'm hoping it's a little bit more sunny in Florida for my guest over here that I have, but
Not me.
I am lucky to have a pelvic floor PT on here today, and I have had some of my friends in the past, but I'm really excited to get talking with this specific one today. Justine, go ahead and introduce yourself, hon.
Hi, everyone. I am Dr. Justine Williams-Roper. I am a pelvic floor specialist. I own a clinic in Pensacola, Florida, where it is not sunny as well today, where I treat men, women, and children for all things pelvic related. So brick and mortar building. I also see patients abroad virtually with pelvic consults. And yeah, I just have a passion for pelvic.
Yeah, as do I, which I love. So
Yeah.
And I remember talking to you originally, and it's funny because we kind of like hit it off right away, which I love.
Yeah.
We just kind of got to talking. And I think I know something we brought up is how like social media can kind of, yes, we all kind of have that connection with pelvic, but it's so nice when you meet somebody just as passionate as you with it, too.
Absolutely.
Right? Because like we said, there's so much kind of saturation of not just pelvic, but even just PT, just there's so many PTs on Instagram and on TikTok now, even too. TikTok's a big one. There's just kind of your face right now.
I have one. Don't worry, I have one. However, it is off the chain.
Yeah, off the chain, for sure.
Off the chain. And there's a lot of people that, that are not PTs that claim to be some form of pelvic something nuanced.
Oh, yeah.
Right? That are covering the material that skilled PTs should be doing. And we can,
I know. I'm with you. Every time one of my friends see like a pelvic floor TikTok and stuff, they always send it to me. And then sometimes I always just find it interesting. I'm like, what type of doctor are they? Or what is going on here? Yeah, it's your face.
Pelvic floor enthusiast.
Yes.
Right. All right. So what are we doing with it?
Yeah. Wait, you posted something about that, right?
Yeah. Oh, I did.
Yeah. Right. Oh, well, first of all, that's a whole other topic in itself. And first of all, what does that even mean? What does that mean?
So I get it, right? Like I don't want to be a gatekeeper of the material. I think that lay persons and everyone should be educated. However, it's bad when it's bad. It's bad when the information is incorrect. It's bad when you're leading people down a path that could potentially harm them.
Yes.
And I just think social media, we don't realize the authoritative role that we play when we sign up an account with any TikTok, Instagram, Twitter. Like, I don't think that people realize that.
Yes.
And I think that some people can get quick buzz because they're entertaining.
Yes.
Right? And
or they're getting a lot of traction on that post or whatever it is. Like, oh my gosh, I didn't know that. I didn't know this. But also, like, what information are you actually putting out there?
Yeah. And so it's like what pops and what, is quickly, like, consumed versus evidence-based. And a lot of things I do, they're not studies and completely evidence-based, but at least tried out, trialed, things that have been proven to work, because there are some techniques that we do, like, that may not necessarily, you can go look up a scholarly article where it's, all of that. However, again, it's the way the information may also miss pivotal pieces that could, again, harm someone, like the tightness versus strengthening thing.
Yep.
right?
That's literally what I'm thinking about right now. It's funny you just said that. So, for those of you who aren't aware, a lot of the times, if we have like a tight muscle, it's known that we may have to release it. But then, kind of the stuff that goes out there in social media, even on websites, going down a rabbit hole of the internet, it's like Kegels, Kegels, Kegels. And like, you might not have to do that. So, you just sparked something for me where one of my friends sent me a post. She is also a pelvic floor therapist as well. And she was like, do you agree with this? And it was a post about how we should be doing Kegels like 8 times a day. Yeah. And it was kind of wild where I was just like, and she said everybody should. It was not like for a specific population or whatever it is. And I'm like, see, this is the stuff that I'm not a fan of. Like this is it. This is it. Because I always think it's good to do like a disclaimer, like this is not for everybody. This is for like maybe this specific population or whatever it is. Like you have to be transparent like that, or else like you will have so and so going ahead and doing that, and like maybe they don't need to do that. So it's like I hear you. And also again, what the hell is a pelvic floor enthusiast? Like I like what is,
like I'm
really
just
though.
like, okay, but see, so I guess again, I don't want to sound like a snob, because I think that sometimes that could be the case even within the sect of the pelvic PT world, where we are these term-based gurus and educational know-it-alls, right? And I'm not like I'm not that type of person. I try to make everything as simple and plain. But again, the platforms only allow you to do certain period amounts of time, right? So like, how long is TikTok? I think TikTok is like a minute and a half or something.
Yeah, they increased it actually. It used to be like 30 seconds. Yeah.
And then you could do IGTV, but the like on Instagram and stuff. But anyways, it's still very limited, right? Yeah. And so the people who may not be so invested in actual education, they're thinking about views, they're thinking about turnover, they're thinking about how can I attract people to my products, to my services, right? So it's that business component. So they give a little bit of cheese. Oh, yeah. And then right? And so it's kind of like they don't, and while they may know that it's not right, but they know, that they don't address those issues of like, if you're having incontinence but you're continuously contracting 8 times intentionally at max contraction all day, like that, they may not, but it doesn't feed their audience.
Exactly. So that's the part that irks me a bit. Like it irks me a lot, actually, I should say. Yeah. And it's clear we're passionate. It's clear we're passionate about this, but stemming from that, what, and this is something that I don't think I actually fully have asked you yet, but what made you get into pelvic floor? I know everybody kind of has their thing, and I think we all kind of have a similar agreement where it's just like, it's so unknown that it pisses us off. So like as passionate practitioners, we're kind of like, okay, cool, I'm now going to take that and I'm going to run with it, right? Like I'm going to, and I'm going to do that. Yeah. So.
Well, I always tell my quick story. I was in PT school. Okay, so like I didn't realize, okay, I wanted to be a PT because my mom got in a really tragic accident where the driver passed away and she did rehab, and I was kind of stuck when I was in undergrad, like which route am I going to go? Am I, I was pre-med, kind of didn't want to do, I was like, where am I going to go? Right. My mom got in this tragic accident, and she reminded me of, that career path. She was like, this is an amazing career path. It's changed my life. So she was like, I'm going to make you go shadow or let you go shadow my PT. So I went, but it was sports. So, and the Andrews Institute here attracts, athletes from all over the world. So I'm there like this young girl looking at all these hot, fine athletes. Like, I'm like, oh, this is right up my alley. Yes. And I get to do this fun stuff and like run around with them. They didn't take me seriously at all. And that was another reason why I kind of like, after, I was looking at them, I was like, they actually don't listen to me. So, and it may have been because I was a student, but I think also it's like, that's a male dominant field. So I wasn't as interested in it, but I did appreciate the art. Yeah. So I applied and I got in. And then when I was in school, I was just trying to make it out. PT school is it's a word that I wish that I could say. It's really, yeah, 0 out of 10 stars when I look when I look back at my mental state when I was in PT school.
Yeah.
And so
1000%.
I actually wanted to just be close to home because I wanted to get from DC, away from DC for a bit. And a student in the class above me, she had a placement in a city outside of Pensacola. That's kind of like doable as far as the drive. And I actually was like, oh, she said it's women's health. And I was like, oh, okay, cool. And at the time, I just thought women's health meant that it was physical therapy based things for women. Right. I had no idea. And actually, crazy thing, I show up the first day, my CI, my clinical instructor is like, just glove up and follow my lead. We open the door and it's an undressed male on the table. Mm-hmm. And that was my very first patient. And I'm like, what the heck did I get myself into?
Yeah.
And I quickly was like, whoa, this is a whole different world. And you know what? It wasn't so much that I was mad or, and pissed off about the fact that enough people don't get it. It validated me. Mm-hmm. Because what I found was that a lot of people look at physical therapy very straightforward. Exercise for shoulders, manual therapy, a little stretchy stretch. And we help people walk when they get in accidents if you're an inpatient, right? Or something like that. And honestly, yeah, I mean, I fell in love with the fact that I felt like a clinician, like a true clinician. Sure. And I do not want to minimize orthopedics in any way. But for me personally, it sparked autonomy inside of me. It sparked the need to learn more because I didn't really care to learn or do more than what I was learning already. And this catapulted me into another dimension of feeling like a boss, to be honest. And so that's kind of what got me started. I couldn't find a job in it after I graduated. It's not a ton of us, really, which was shocking. Yeah, it was not easy. It was very shocking for me. Especially in the DC area. I was like, why can't I find a job in this? And the jobs that I did try to get into, they're like, well, you're 70% ortho and you'll be 30% pelvic.
Right. That was my first job, actually. Yeah, that was totally my first job with doing pelvic part-time. Mm-hmm. So I guess 50-50 if we want to put it that way. But it's not easy to find just pelvic. So I get that. I'm sorry, I didn't mean to cut you off. Keep going.
No, I relate. And I guess maybe because I had done pelvic at that rotation for 3 months straight, 4 months straight with all pelvic, I wasn't interested in the ortho. And that was probably the spoiled brat in me and the greenness in me, not knowing that it probably would have fostered something, but everything happens for a reason. So, I did inpatient at a long-term acute care facility, trachs and ventilators, really sad stuff. And then I went into peds just to make myself smile again because that was so depressing to be. But all the while keeping my little, pelvic skill set and doing more continuing ed. And then I married my husband and moved back home and I opened up shop because again, there are no,
Yeah. So I love that. I mean, I love everything about that. And it's hard to find a full-time pelvic floor job because we also, as you know, we need to have more of a background in it. A lot of people don't kind of want to take you in if you haven't had a mentor or something. Clinical or something, right? It's funny you said the first person you walked in with on your clinical day was a male. So my first day, you're gonna die, and I'm not even making this up. My instructor, who I actually worked with for a while, still my mentor till this day, she was like, today is such a mixed bag, and she was like, you're gonna kind of laugh when you see this. She was like, I went on a rant about how I see mostly postpartum women and all this stuff. It was a woman with mastitis. Mastitis. I just made up a word.
Okay, that's a tricky one anyway.
Added a whole other itis into mastitis. Then a male with prostatitis. And then, that's what I was going for. Then, a woman postpartum. Then a woman with pelvic pain. I was like, what is happening? It was all over the place, but I was just like, cool. And I went into it being like, this is going to be so tough, but I also think this is going to be something that I like, which clearly I did. And it was more so every patient that came in, and honestly, 99% of my patients that come in now, they're just like, why didn't I know? Like, why did I have to Google this? Why did I have to Google my symptoms in order to find you? Why am I in New York City and my neurologist had no idea to go to pelvic floor? It just kind of, it's always that, and it always kind of reminds me, even on one of my bad days where I just like want to be home, because that's just real
Sure.
life, right? Like,
Me too. That was
yeah,
yesterday for me.
yeah,
I was
for
like, I do not
sure.
want to be here.
Yeah, it's real life, and like I love my patients if you're listening,
Oh, for sure.
but we have our days, we have our days too where we want to go home, and that's that. But it always reminds me when somebody says that, I'm like, ooh, yep, that's why. That's why I'm doing it. That's exactly why. So,
and you do it for you. You do it for your patients. You do it for the culture. You do it for the pelvic PT culture.
Oh yeah,
and that's very comforting for you to say that still happens in New York, because I'm in Little Pensacola.
Yes.
And I'm like, why are these urologists like so clueless? I have one boss, female urogyno that like sends people by the boatloads, but like some of the other ones, there's so many of them that I'm just like, why do you not?
Yeah.
No.
So where I will say we're different, because it does give other people comfort when I do tell them that. They're like, hold on, New York City and like Miami, it's so like people aren't. It's not like a buzzword and all this stuff. Like it's hard for them to find us still. But what I will say is that we are a little saturated with pelvic floor PTs, right? So it is easier for them to at least find somebody. But what I've been finding from patients now is that they're like, well, I only saw so-and-so for a half hour, and then I was doing exercises on top of it, like with another person and like not the PT. So like now I'm finding that even though it's saturated,
quality.
Yes, the quality is
not,
for sure. Where I am lucky enough to be at 2 jobs where quality is very important to my employers. Very, very important. That's over anything, actually. So it's like you get to see us completely one-on-one, and nothing against AIDS or anything. I was an AIDS, so like I get that. However, I think pelvic is so different than a sprained ankle. It's so different than that, where things are so intimate, where it's just like, if somebody wants to say to me, with this exercise, I'm feeling the same pain that I feel in the missionary position with my partner. So like, what's happening here? Is there a connection? Is there, from this to sex or whatever? And it's like, they don't want to ask the aide that. Right?
They don't want to ask the aide that. And the aide is definitely probably not skilled enough to answer it in an appropriate way.
Totally.
You know what I mean? So it's multifactorial. And like, I think part of it is when I look at the models of businesses, right? Because I have a hybrid model where I take part insurance and part cash. These larger clinics, they're mainly insurance based, and then some of the other clinics that are cash based, they have higher rates. So they have a smaller amount of people that are seen. So let's say the ones that get a lot of traffic, probably because they take insurance, they're so limited on time that they can spend with people. Like that they're seeing patients that need to be seen for like an hour or more for 30 minutes. So they're jam packing, all this stuff that needs to be like, all this like education that needs to be in there, all of these like specific things that need to be, discussed and implemented. They can't really do it in one visit, and so like they're just speeding through the day. And so I definitely understand quality and like quantity and specificity and like thoroughness. Like, it's hard depending on who you work for and what but
1,000%.
It's good for PTs who understand it and are able to offer that quality care. Because
which also isn't easy too, because then you also have to tell your patient, like, if your insurance doesn't cover this, we got to pay the self-pay rate, right? Or, like this specific rate until like your deductible hit. There's all this stuff. And then then that's the part that's hard. However, I always explain that you get a full hour with me, like a full blown hour. Whereas like with other places, you're not going to get that, like you're not going to get that quality care. And that is something that honestly I would like to see change a little bit. It's like a lot of people then think, they spark it in their head, this is what pelvic PT is, where they're then seen for 15, 20 minutes with, with somebody, and then they go off and do exercises. So that's the part that kills me, which is like, why my website's there, why my Instagram is there, why, I would like to raise awareness for that. And I do want to start posting a little bit more about that. Like, actually, there are places that see you for longer, whether that's 45 minutes, even 45 minutes, I think is great, in comparison to one-on-one or whatever it is.
Right.
So
Yeah.
what do you do actually for your business? Yeah.
Yeah, so I break them down. So I do 30 to, I do a range. So 30 to 45-minute sessions, and then 50 to 65-minute sessions.
Sure.
Depending on what the person needs and what they can afford. Because sometimes I do feel like something is better than nothing.
Yeah. Yes. Totally.
I know we were going to probably talk about two things I wish that would change. I wish
go for it.
I wish that people's viewpoint, when they find out that pelvic floor physical therapy is still therapy, that they don't automatically gravitate to that. Can my insurance cover it? It's just another checklist thing I can do.
Yes.
I think I really wish, I don't know what the answer is to shift people's mindsets on the value of pelvic floor PT, and that pelvic floor PT is a subset of its own.
Yes. So I can stem on that. Stem on that a bit. Going into my initial question of what are things that you would want to change? And I can go down a rabbit hole with that. I can go down a whole rabbit hole. But had a conversation with a patient yesterday. It was his first visit, and he very much so is not a believer. And I get it. That is something I honestly completely understand. I completely get it. You have seen a million. How many urologists have you seen? How many, what else have you done? Great. And I tell all my patients, I'm like, we're usually the last in line. I get it. I trust me when I say I get it. But then what I always say is, we wouldn't have a clinic if we weren't getting people better. Right?
Sure.
Yeah, I could throw my hands up to that one. I could shoot my horn with that one, right?
Unless I have money to waste and time to waste, just sitting here looking crazy.
Yeah.
People come.
Right. But actually, though, right? It wouldn't be a clinic if it wasn't the case. So, my spiel on causing pelvic floor to be a little bit more important on, your, say, your checklist of things to do is, would you go a day without washing your face or without brushing your teeth? Or if you have some neck pain, without stretching your neck, you want to lose those few pounds, what are you going to do for that, right? It is so taboo, the talk about peeing, pooping, sex, pelvic floor stuff for damn sure. That's all that stuff. It's so taboo that I always say I want it to be looked at as another form of self-care. Totally another form of self-care where those are muscles down there. So just like how you would stretch out your neck, stretch out those hamstrings if you do want to go running, right? Your quads, all of these things, why not there if it's something that we use every day, all day? And that's on that for me.
And some of them still won't care. Some of them, and those people don't wash their hands, and they don't brush their teeth or wash their face.
Right.
Okay.
Right.
Some of those people just, some of them we have to really start at ground zero.
Yeah.
But yeah, making it simple and plain, but also putting so much weight on the emphasis of quality of life. What does that look like for you to improve this problem? How committed are you to doing that, and just opening their eyes to the possibility that their body can function differently if you pour that self-love and self-care into their body, right?
Yeah.
And I have people that come to me and they're angry.
Yeah, so angry.
They're so angry. And I'm and depressed and just hopeless.
Yep.
Right? And
for sure.
And so yes, pelvic PT is an island of its own. And the job is such a unique job because we have so much that we have to do as providers and clinicians that are not based on me touching you even.
Yeah.
It's so psychological before we even get you started, right? Or as we go along. And that's why, I know you were talking about how some days you want to don't go in. Sometimes we don't want to go in because we are emotionally exhausted.
Yep. Oh, yeah. 1,000%. We're so drained to the point where, and it's not, again, nothing against our like patients,
Sure.
right?
No,
But
not negatively.
of
Yeah.
course, but it is a lot to take in. I actually did have a patient ask me, and it was just a very interesting question. I've been seeing her for a while, and I felt comfortable answering. She was like, she goes, I think about, Liz, like how many times like I've cried here with you, like sitting here, like, laying down on this table and all this stuff. And she was like, and not to say that all patients cry either, but she was like, I feel how vulnerable I am. And she was like, you do this all day. And she was like, you are, right? Like, you do this all day. And she goes,
What is wrong with you?
Right. And she
Why?
was, yeah.
Do you subject yourself to this?
And she, but no, right? And she goes, if you think about it, say if somebody's working all day and then they come to you, you're also either somebody's in pain, something is wrong with us, right? Like something is wrong with us. So it's like there is always a complaint, and you need to expect that from every patient. There is not going to be a patient that comes in that's just like, yep, this is perfect, but I'm just here.
Yep.
Oh, yeah. And the way she put it like that, I was kind of like, oh, dang. Like, yeah, you're right. And she was just like, I hope you take care of yourself too. And I was just like, ooh, wow, yeah. And it made me really think about, ever since she said that to me. Somebody said that to me recently, actually, but this was like a year or two ago that this patient said that, and I was just like, wow, you're so right. And it made me realize too, like, if I want to take care of other people, I very much so need to take care of myself too.
100%.
Which totally leads into the next question.
Yeah, it does.
That I was going to ask you too about self-care. And now, like eventually I do want to have my own business and all that stuff. But I think even more so as a business owner, you got to take care of yourself, right? So give me top two things you do for you and nobody else.
So this is a work in progress, and I don't think that any business owner, unless they, have been in the game a really, really long time, or even then, they can attest to, like, you have to reinvent the self-care, structure for yourself. But one is active. So the first one is not like I just, stop and do something specific. The first one is creating boundaries.
Yeah.
In my practice. So, for example, yesterday, I had a patient who was scheduled for 12:30. She came at 1:30 when I'm done on Fridays.
Oof.
And she's like, I'm so sorry. Da-da-da-da. And I'm like, I'm on a virtual consult right now. My admin is sitting there, and I hear her come in. I was like, I have my last virtual consult really quickly. And I told her I would see her. And so I was exhausted yesterday.
Yeah.
Kid you not. And, part of me was like, Justine, you've been working on setting your boundaries. This is an active opportunity to say, you missed your appointment. You have to pay your fee. See you next week.
Yeah.
But the other part was, I asked myself, would it harm me to stay 30 minutes of what she was scheduled for? And I said, you know what? No, but, after you have set it up to where you can go rest now. And so I made the active decision to say, okay, I make that choice to say yes, because I could have made the choice to say no. And so before, I was powerless. I would have not even thought it twice about it. I would have said, I'll stay the whole hour. I'll do all these different things, to accommodate other people. And, I actively had to use my autonomy choice muscle where I can choose. And so for me, setting boundaries and making informed choices for me are a way of self-care. Because before, as a business owner, I think as business owners, we're so desperate to keep it afloat, and we're afraid that if we don't do certain things that appease our clients, that we will close down, right? We have that fear of shutting down. And I think that that's a misleading fear that we have to actively pursue against, to actively press against. And so, actively choosing to set boundaries. I had another patient come in, and this wasn't recent, but she had fecal incontinence. She had an accident that was atrocious while she was there. She came back up to the front and she was like, I'm not comfortable keeping my card on file for accidents or incidentals rather. And, if you need to order anything for me, if I can't, so I'm a trustworthy person. I'm not keeping my card on file. I was like, well, I'm sorry. There's nothing I can do for you. The only other thing I can do is if you put a retainer down and we just deduct from that retainer and we will totally reimburse that to you, at the end of your treatment, you'll get it all back. Nope. And she called back again after that, trying to speak to someone else to get on the calendar.
Oh my goodness.
And and I put it on it's in the notes that this person, and she was like, oh, I think you have me confused with someone else. And we're like, absolutely not. That was a fiasco. We will remember that forever, right? And so the setting the boundaries, sticking to them, and it doesn't feel good all the time, but that's a form of self-care as a business owner, because I know some business owners will listen to this. Like, actively setting boundaries is a form of self-care. So those are examples of I'm sorry, I'll refer you to another clinic down the street, or I'll refer you to another resource, let your doctor know. Like, actively setting boundaries will help not feel so depleted. So that's an active example.
Yeah.
Of the self-care. And it's hard because people will always be people, and you will always want people to want your services.
Yeah.
But a lot of times, using that muscle and building that muscle helps you understand that that's not the case, that everyone is your patient.
Yes.
Right.
Yes.
Especially in the entrepreneurship world. The second is going to be actively, my therapist told me this. Mm-hmm. She was like, you need to either do this yourself or have your admin assistant schedule days in the calendar that are just for you.
Right. Yep.
And again, you circle back around and you say, oh my God, if I shut down one clinic day, then I won't meet my monthly goal.
I mean,
schedule it in other days.
Uh-huh. Yeah. And that's that. Like, that's literally that, because it's so important to take care of yourself. Like, you shouldn't be living to work.
Right.
You work to live. Like, there's a reason why you started your own thing. It's so beautiful that you're passionate about it too, which I am as well, right? I'm completely. But the reason you also did it is that so you could have more autonomy, right? So you could do all these other things. Now, I talk about boundaries on here like it's my job. Like it for sure. Literally like it's my job. I actually saw something this morning and I screenshotted it. So hold on 2 seconds.
Yeah.
Let me bring it up because it literally just went with what you said. It went with what you said. So this person tweeted, the real flex is training your boundaries to be stronger than your empathy and feelings.
That's it.
Like,
easier said than done.
Much easier said than done. So
facts.
Actual facts. Like I went, so not the credit card situation that you went through. So now I actually know business owners though who like, you have to put something or else you're not booking an appointment. Like that.
Yeah.
And so I know where that's hard, because then you also want to please somebody and you also want to give them care, but you also need to respect me. You also have to respect me too, right? And then that is like the weird rabbit hole of like being an empath and trying to understand somebody's feelings and doing that. But then that's even like, you saw that patient at 1:30 yesterday, right? And I get where you did it. You are the business owner. So, like, you did what you had to do, but then it's also how many times are you going to do that, right?
Exactly.
And, like, so that's what you have to think. Like, if this is, like, a once-in-a-blue moon type of thing, then, like, okay, you did your thing.
Yeah.
But then it's, like, you can't have that keep happening. I did have an employer like that. Very much so. And I saw that it like depleted her. You know, she would, if a patient came in an hour late all the time, she would still see them instead of being like, you know what? Like, no. Yeah. Like, I can't keep doing this. Like, at my job, it's so wild. Like, one of my patients yesterday, she's so cute. She's never late. She's like never late ever. But she came in an hour earlier by accident because she thought that was her time. Now, luckily, I didn't have a patient there because it was my lunch hour, but I also did not have a patient afterwards. So
it worked out.
But my business, our admin came up to me and they were just like, you want her to like wait an hour? They're really respectful, you know, like
That's
of your
good.
time, which I think is amazing. And I was like, no, I'll see her now. You know, like I could have lunch next hour. Just don't book me anybody, you know, and like they're very good about respecting your boundaries in that way.
That's awesome.
Right. So I think it's so important to do that. I even think an active self-care thing that I can think of is, again, the boundary thing. But more so to always making sure that you feel comfortable.
Right.
Okay, so it's like, and that, again, rabbit hole. Could totally go off on, I can go off on that. That's not even, but masks are completely still a thing in our clinic. You know, there are a lot of places indoors now where you have to show your vaccination card in New York and stuff too. For us, we just have everybody still fill out the form and everybody still has to wear a mask because we are one-on-one. We're in a room, separately with our patients too, right? Pelvic, hello. So so everybody's completely separate from each other. But my boss was like, you know what? Let's just keep things the way, like the way they are. And we were like, okay, cool. Had somebody come in, took off their mask in the room. And I was like, it's still policy. Like, we do have to keep it on. I completely get it. It's been hot here. It has been hot, at least for New York. It is hot. And it's the city. Subway, it's gross. And he was like, I'm really hot, though. And I...
What? Did you? Okay.
And I was just like... I completely joked around, and I was like, I get it. And I was like, I'm sweating. I'm sweating, like I completely get it, but I do have to have you put it on. And he was like, okay, cool. So that was that. Had him change, and he took it off again. So now you're pissing me off. Like, now you're bothering me.
Now we're going in a different direction.
Now you're bothering me, right? Where it's just like, I said it once, and I shouldn't have to say it again, right? Right. And I said to him again, like, I need you to put on, right, I need you to put it on. He's like, are you not vaccinated or something? So then he leads into that. He was like, are you not vaccinated or something? So now he's getting a little combative with me. And I said, I was like, no, I'm 1,000% vaccinated. I have been.
Which you shouldn't have to, like.
I shouldn't even have. I shouldn't even have to say, but we'll go that route, And I was like, I have been since February. And he was like, yeah, but like I work from home. You're the only person I'm seeing today. And I was like, you might be the only person I might be the only person that you're seeing today, but you are not the only person that I'm seeing today. So we're going to put on the mask. And then we're going to keep it moving. That's what I said. I was just, and I said it very respectfully. I wasn't like, it wasn't, but still, and it made me realize though too, I was just like, no matter what, you can be like the best practitioner in the world, but there's always going to be like something like that might be thrown at you, whatever it is. So I reminded myself, like, self-care in a way where it's like sticking up for yourself too. I could have easily just been like, okay, cool, no worries, keep it off. But then what is that also doing? Then you're going to keep it off each time. What if you then see one of my other colleagues who is completely not comfortable with that, and then it becomes this whole thing. So for me, again, actively self-care, but in a way to make yourself feel comfortable. I could say all day, like, yep, like doing a facial in the morning or, all these other things.
Yeah, that's like Rudy Tooty.
For sure. There's more like deep-rooted shit like to go over, like.
And if I could be completely honest, I don't think that Dr. Justine 3 years ago would have been able to.
Me too.
And so that's why I call it a confidence muscle. It's something that you have to practice and build, right? We are not above reproach. We are not above mistakes. And everyone is in a different place in their life, as far as confidence goes.
Yeah.
Because it takes confidence to be able to stand up for yourself. Totally. Like when I was a kid, I remember when I was a kid, I was like, as, outwardly confident as I appeared, I was internally like the scaredest, most timid person. And so that carried through into my adult years and into my professional career. So it wasn't until now that I realized how much power I have over, my comfortability levels when I'm interacting with patients and with people in general. right? And so I encourage everyone to like practice that a little bit at a time.
Yeah.
So that you build it up. So like making choices for yourself in the professional sense and in the personal sense. So when bigger events happen, you have a little bit more oomph, you have a little bit more control, you have a little bit more courage and bravery to say what you need to say and do what you need to do.
Yeah. And I love that, actually. I always think, and especially when other therapists come on here, I always like for you guys to give like a piece of advice. Like we just had a student that just ended at my full-time job,
Cool.
and I told her, like, confidence, man. And it's hard. It's hard when you're just first starting, and especially in pelvic. Like, it is not always easy to sometimes say, I don't know, or to sometimes, or to it's a lot, it's definitely a lot. And it, like kind of what you said before, not to knock any other form of PT and everything, but like pelvic is still relatively new to people, and it's just like it's not being taught in schools as much as obviously like neuro is, ortho, and all this stuff, so it is hard to get into. But I think that's a great piece of advice, like just these little steps. So whether that means, if you are a business owner, like making sure to charge that fee if somebody doesn't show up, or just like some of these little things. And that maybe might mean that like you're not so comfortable yet, like telling somebody if they show up at the door that I can't treat you. And that's okay. And that's okay. You just have to, though, remember your boundaries and go from there. But
yeah. I mean, I had a patient last week. She called at 12:10. Her appointment was at 12:30. She said, I'm not going to make it. My front desk staff said, hey, that's going to be a fee if we can't fit you in before we close today at 1:30. She said, well, I can't do that. She said, what's the fee? The fee is in your paperwork. It's also hanging directly at the scheduling station for you to remember. She said, that's steep. And she said, that's steep. And my front desk staff said, she was like, and there's nothing we could do. She said, okay, well, cancel my other appointments. I'm going to have to reconsider this.
Wow.
Yep.
And I mean, you know what, though? And I hate to say this. Like, we have like a grace period. We're like on that first time. Okay, it happens. That's fine. But if you also keep doing that, people will continue to cancel and do all this stuff. And I know that, it's hard, but it's one of those things that like you also, as a business owner, then you can say, okay, like I may have lost that person, but if this was also somebody that's going to keep doing that, like I also might be better off, as much as I want to give that care and stuff too. But listen, when my doctor's office is like, we're going to charge you for this, like I know damn well to, cancel 24 hours before, or whatever the case may be, it's like, it's completely, it's fine. Like that's how the offices run. That's how the offices run, and that's how it's run. And that's it.
And I think that leads to the respect of the field too.
Yeah.
I always compare us, like in thought, compare us to chiros. And I'm like, they consider their chiro their doctor. They will automatically call them Dr. So-and-so. They will automatically treat their chiropractor. And sometimes I think it's because of how chiropractors have their entities, respective entities have advocated for their fields.
Yes.
And so I think that, like, again, when people think physical therapy, no matter if it's pelvic, if it's ortho, if it's neuro, if it's peds, they think physical therapy and they put it on a lower platform.
Yes. 1,000%.
And so that's a part of that. Like what I would change, kind of like the advocacy. I would change how like figuring out or coming together to figure out how we can make ourselves authoritative in nature, so that when patients come to us, they don't think of it as just another thing that they have to go to.
Yeah,
that it's a specialized, special thing, a special service.
Yeah, and we went through a lot of schooling, in order to do this and everything too. And then you go the pelvic route
for a lot of people.
And then we also took a lot of courses, right?
Yeah.
And we have to, actually, in order to keep up our license. So like we're continuously working and continuously doing a lot. So what I will say is that I am somebody where I still don't like to actually, when somebody does come in and they're like, hi, Dr.
Mm-hmm.
Alyssa, or whatever, I'm like, no, it's
Mm-hmm.
okay. You know, like, you can
Mm-hmm.
call me Alyssa. However, I still want to be respected. You know what
Sure.
I mean? Like, I still want to be respected at the end of the day. And it's funny, one of my friends was like, you should totally just, like, introduce yourself. Do you know what I mean? Like, introduce
Mm-hmm.
yourself as that. You know, like, it's okay to say, like, I'm Dr. So-and-so. And I'm like, I know. And I'm like, I think that for me, I like that kind of comfort of, like, you know, my
Sure.
patients just calling me Alyssa. I know everybody's super different with that too.
Yeah, everyone has a, yeah.
Yeah, but
Mm-hmm.
then, you know, if there is somebody that comes in and they're just like, oh yeah, I've been to PT and, like, you know, it's just this and this and this. I'm like, actually, you know, there's a lot that goes on in our heads about this, and this. And I remember I had to kind of break it down to somebody once of, like, these are the things that I'm actually looking out for that you have no idea that I
Mm-hmm.
am looking out for them, right? And they're like, oh my
Mm-hmm.
God, like, I didn't know that, you know, or like the behind the scenes stuff of, like, what does my paperwork now look like too, you know, like, and all this stuff. So it was really interesting, and it was honestly just like an education thing for them, like, and
Mm-hmm.
it was no bad blood at all.
Yeah.
But yeah, it was really interesting to see. But like you said, the profession needs to be respected
Yeah.
way more. That is for
It's
sure.
not about the
But
title either. I don't think it's necessarily about the doctor part. I think it's
yes,
the
yeah,
posture part.
yeah,
I think it's the posture that you have. You know that you're urologist, that everyone can't do urology. You know that urology is special. That is what they specialize in.
yeah, yeah,
So you have a posture of reverence almost for the fact that they can do something that other people can't.
yeah, totally,
So it
totally.
should be the same for pelvic floor specialists,
Yeah,
right? That we are special and their urogyno can't do what we do.
yes, yeah, yeah,
Their
yeah.
their OB can't do what we do.
And it always takes, though, the patients that just come in and experience that for
Sure.
them to
Mm-hmm.
see it. So a lot of, like, what we're doing is a lot of word of mouth, right? But
Mm-hmm.
then also our podcasts that are out, the social media that's
Mm-hmm.
out, you know, all that stuff. I
Mm-hmm.
think it's super important. But
Yeah. Yeah.
yeah.
I can beat that to death. I can
Oh,
beat that
all
to
that's.
death.
I say this in every episode of my podcast. I could talk about this all day, all day.
Uh,
I say it all the time.
mm-hmm.
But I wanted to thank you so much for being on
Yeah.
here. This was so great, and I would, of course, want you on here again.
Yeah.
But where can everybody find you? You know,
Yeah.
yeah, lay down all your social media stuff for us, please.
Sure. Socials. I'm most active on Instagram at Dr. Just, Doctor spelled out, and then JUS. We're also on Facebook. I am also on Facebook. My facility's name is her, HER, and then the full word physique. It's just a little play on words for inner. And that's also our brick and mortar Instagram as well as our Facebook. Those are where I'm most active. Also on YouTube by the same names.
Yeah.
And so super excited to have been here. You're so excellent. And I love the fact that we can talk about this stuff because we need it. We need camaraderie. We need, for our voices to be heard and for relatability. So I'm 100% here.
Aw, thanks, hun.
Yeah.
No, 1000%. It's a field that needs to grow. That's for damn sure.
100%. I'm here
yeah.
with you.
Thank you so much.
Thank you.
Thank you guys so much for listening to the All Things Pelvic Pod. Have questions, concerns, comments? Want to share your story? Remember to follow me on Instagram at _pelvic floor playbook. DM me, share my stuff, like it, and let me know what you think. As a reminder, this is not medical advice by any means, so don't be out here doing a bunch of nonsense in these streets. If you need me and want a vibe, you know where to find me. I'm out.